Do you struggle to find answers to your pelvic health problems? Do you feel silenced in your quest to just feel better? Women, girls, sisters, if you have experienced infertility, PCOS, incontinence, painful periods, sexual trauma, and so much more associated with the pelvis, then Women's Pelvis Wellness is the place for you. Me and experts from around the world are joining here to get you the answers to the holistic health that you have been seeking. Please join us in being a pelvis wellness warrior. Okay, thank you again for joining us today for another installment of Women's Pelvis Wellness. And today I have a special guest. I always say that because everybody's special. But Tara Thompson from the Atlanta, Georgia area is with us today. And I met Tara actually through Facebook. I've never actually met her in person, but she's doing amazing things. And I'm super jazzed about all of the ways that she's helping women through pregnancy and postpartum. And I am just excited for you to share everything that's going on. So how did you kind of start out in this, I guess, this, aspect of your life?
So I have 3 children of my own and 2 grandchildren right now. But with my children during my pregnancies, I didn't have any childbirth education. I've never even heard of a doula. I didn't know anything. I didn't take any classes or anything. So with my pregnancies, I basically just was dependent on my doctor, just listening to what the doctor said. And I never looked out for anything else on my own. So I thankfully had good pregnancies and then good labors and births as well, where I didn't have any medications or anything. When I was younger, I had a neighbor of mine that was braiding my hair. I think I was 16 years old. She was braiding my hair. And then, we were sitting out on the step and she was like, it's about to rain. And I'm like, what are you talking about? It's sunny. And why would you say that? She said, the spot where I had my epidural. And I'm like, what? Now her child is 4. And that stuck with me because I'm like, 4 years later, she's still feeling this pain. So by the time I had my first child at 22, that was the education that I had, not to get an epidural. Yeah. That's basically what I went on, what I went by. And that's how, that's really what it was. My focus was just not getting an epidural because I was like, this is one day, that I'm going through this. And, I don't want to feel something 4 years later. So I was like, whatever I have to do. So that's basically all the education that I had as far as that. So years later, I became a massage therapist. And then during massage school, a little bit of pregnancy training. But then I became a certified infant massage instructor. So I started doing that. And then I lived in New York at the time. So then we moved down to Georgia. And I met someone, and then I became, I started working at the hospital where I started teaching infant massage. And then they asked me to teach pregnancy for massage and labor, where I teach couples how to massage, the partner how to massage the expectant mom during pregnancy and labor. So I started teaching that, and that's how I got into, just pregnancy itself.
Right.
Teaching that. So I've learned all this information. And then I was like, oh my gosh, and I put it with comparing it to my births and labors and pregnancies. And I was like, I could have helped myself so much if I would have known this information. But the biggest thing was the mindset, so helping people with that, because like I said, I didn't have any education. All I had was a mindset that I did not want to have the epidural. And that's, basically how I got through, and it was fine. Of course, it wasn't fine. It was, challenging and tough.
Yeah, for sure.
So that's really how I got started in pregnancy and labor. And so in 2010, I became a birth doula. And I forgot a few years after that, I got my training for postpartum doula as well. So just as the years went on, I just got more and more in depth in all this information. And just, I love working with women. I love pregnancy. I think pregnancy is amazing. I would have more, but you got to have the kids after and grow up and all that other stuff. So I'm done. I'll stick with the grandkids now. But I
Yeah.
love to help women, throughout pregnancy. So I'm a massage therapist as well, as I mentioned, but I specialize in pregnancy and postpartum.
Okay.
So,
Yeah,
yeah.
that's really great. I we took like a birth education class, but it was such a joke. Like we literally didn't learn anything. Um
Really.
and I remember when I went in to have my first one, it ended up being an emergency C-section, but they wouldn't let me do what my body wanted to do. I wanted to squat, I wanted to move, and they were like, "Oh, if you squat, you're going to push and you're not dilated enough." And I'm like, "But I want to." Like I just wanted to. I
Body's
just
telling you to do that. Yeah, like you
yeah.
said.
And so what I find so fascinating now is that you know, doulas are becoming more popular and midwifery is becoming more popular. And this is all old stuff. This is what our mommies and our Grammys and our aunties and neighbors, sisters were helping us with before it ever became, male centered and put in a hospital. So all of this stuff, this is old stuff that that's kind of how birth is supposed to be. Um, so I'm just glad that, I'm glad that it is becoming more and more educational, so that women know, like your body was literally made to do this, but we've been told for, many generations that we can't do it
By ourselves.
safely by ourselves at home with a trained, midwife. Or, I know a few couples actually, the baby just came so fast before the paramedics got there and dad delivered it, and they're fine.
With the
Yeah.
instinct.
So it's fascinating, and I love, this aspect of it too. So thank you for coming on and just exposing it a little bit more.
Yes.
Yeah.
So very exciting. So, in my business, what I do here, like I said, I do so many other things. So I'm a massage therapist for one, specializing in pregnancy and postpartum. I'm also a labor and postpartum doula, but I'm also a childbirth educator. So I'm certified in Lamaze, but I also teach evidence-based birth classes. And that's what I've been teaching currently, because I just love those classes. It's based, like I said, it's based on evidence. What I love about the program is the creator of the program, the founder, she is a nurse that went and got her PhD. So she started the program because she was a nurse when she started having her children. And when she went into the hospital, she realized that they were treating her like a patient, treating her like she had some medical condition and things. And she's like, like you said, my body is telling me to do this, but they're like, no, you have to stay in the bed. They wouldn't even let her get up to go to the bathroom. They wouldn't let her eat, so that's when, after that birth is when she went and researched and started all this, she started blogging from there. And then she created this whole program that is just, worldwide now, and it's amazing. And I love teaching it, especially to couples that are planning to give birth in a hospital. Because when you're, birthing at home or birthing in a birth center, different things like that, like you said, they're with the midwife, they are more, they sort of let you do what your body is telling you to do, because they're not depending on the medications. And as far as the money are, the more we give you, the more we can get paid, type of mentality. They don't have that, especially if you're doing a home birth. It's more the less that we do, the better for you. And that's how it should be. But unfortunately, that's not how it is in the hospital. So with these classes, it helps to help them to educate them, for one, be informed, know how to ask questions, even prior to you, going into labor. Mm-hmm. So a lot of people ask me, like, when should I take the childbirth classes? And a lot of people, like when I used to teach at the hospital, I used to see people coming in at, 35, 36, 37 weeks. And by the time I'm giving them this information, they're like, oh, well, it's too late for me to switch now. When actually it really isn't. But at that point in their pregnancy, a lot of people are not going to.
Sure.
So I do recommend that anywhere from like 20 weeks on, you can take these classes, because again, it's giving you information to help you, for one, know what questions to ask your provider to make sure you're on the same page. You may think this person is wonderful and have a wonderful personality, but when it comes time to your what you believe in, as far as beliefs in both of you, you may be off with that, and you're asking them
Right.
questions and they're like, no, I'm sorry, we don't do that. So it's better for you to find out that information early on. And then this way you can, just change providers if you have to.
Sure.
Be comfortable.
I was going to ask a quick question. Is delivering at home with a midwife legal in Georgia?
No, unfortunately, it's not. No.
See, and that's just crazy to me. And I started learning, obviously through what I'm doing, I'm learning more and more. And there are several states where it's like a felony with a prison sentence for the midwife if they help a woman deliver at home.
Exactly. Yeah.
Now, come on.
I know. And like you said, this is what we used to do years ago. So why? And it's sad that, we've come to this point because it is, depending on hospitals and their whole establishment and, as far as money, it's sad that it's just around money, because in the hospital, the more they do to you, the more money they get.
Yeah. And honestly, I mean, when men took over women's health is when it started to tank.
Yeah.
I mean, I really just don't believe it's the truth, who better to teach you about your body and about birthing than, your women in your life who've had several babies. I mean, it just blows my mind, but, let's have a man teach us about pregnancy and delivery. Like, they literally can't. They have I shouldn't say that. They can definitely give you the science behind it. Obviously medical intervention is necessary in several cases, but I also wonder is if we were supported properly and encouraged properly, would those medical interventions would they have even been necessary? I ended up with a C-section after my water had been broken for 14 hours. I'd been on Pitocin on my back basically for 12 hours, and I didn't even dilate to 4.
Wow. Like you said, they wouldn't let you move. Like,
they wouldn't let me move.
To move. Like, hello, it just only makes sense, like you said, between a male's perspective and a female, because just in general, your body, if you're in an upright position, gravity is going to help. The baby has to come down.
Right.
Okay? Not like the baby's going to just shoot out the side or, do something. So you laying there is much harder, for the baby to come down, because now the baby is doing all the work. Right. As far as you helping them, you're participating in that. So that's why, those upright positions are so very important. But
women did not give birth on their back. The reason why women give birth on their backs with their legs spread is so that the doctor can see.
So they can see. They're more
comfortable. That's literally the only reason.
Position, exactly. Yep. And that's like you said, years ago, that male, obstetrician said that this was a good idea. This way they can be sitting right here comfortably, in their chair, and then have the moms up in that position so they can see. Yes. And they don't have to do anything. Whereas I've seen midwives in births where they're all in crazy positions, just getting down there because wherever mom, needs to push and give birth, they're there to catch, to help to birth that baby. So, absolutely. Yeah.
Wonderful.
Really different, as far as, like you said, male and female. And, as far as the legality in the state here, I had a lot of midwife, home birth midwives that were, at the state capitol and going down and, really fighting, and we were getting close, and then the pandemic happened. So all of that shut down. So we're like at a pause right now. So,
Well, I know in Alabama, it just became legal 2 years ago, but because everything takes so dang long to get through, they still aren't really able to enforce it there.
And that's
and the doulas aren't being allowed in the hospitals because they're not, you can have one support person, and that obviously is probably going to be your husband or the father of the baby, or maybe your mom. There really aren't a lot of people who are going to choose the doula over family. And you can, so that's, really a bummer.
Yeah. It really is.
So
Yes.
I know that you recently left your job at the hospital to kind of go out on your own. So
Yes.
tell me how that is. How is that going?
So it's exciting. It's a lot. It's busy, very busy. But just trying to get the word out, that's the biggest thing. So I really appreciate you doing this. So I do. I love this. But helping to just, spread the word because like I said, with all the pandemic, like you said, with hospitals and different things, and they're not allowing doulas in. And, I taught classes there and, you know, they changed even the childbirth classes. And I'm like, seriously, like what are they supposed to learn? Whereas normally like our 8-hour classes, our 8-hour childbirth classes are now 3.5 hours. And I was like, how did you expect me to give
Well,
them
you
this
know everything now.
information? Exactly. In 3.5 hours. Like, okay, now you're ready to give birth. It's like,
Well, and you also have to think too that these women are pregnant. I mean, you know how you are when you're pregnant.
Mhm.
I forgot stuff all the time. Like they're going to need to hear this information more than one time
Yes.
to
Yes.
retain it.
Exactly. And that's another reason why I love evidence-based birth, just because like you have 3 or 6 months access to the information. So, and then it's like in little video clips. So it's not like they're giving you all this, where you have to binge watch all this information at one time. It's like, because the human mind, you sit there, 15, 20 minutes and you start to drift off and you're not absorbing anything, and then you have to like come back like, okay, wait, I'm sorry. What were we talking about?
Yeah,
So you can, and it is in little video clips, and the longest I believe is like 15, 16 minutes. So you can watch it. And again, you can go back and as many times as you want, to have that information. I had a birth where I attended, well, it was a virtual birth or labor. And the dad is texting me. And as he's asking me questions, I'm responding. And he says, never mind, they already did it. So it's like, for one, he didn't have that information. He didn't take my childbirth class. He took another one. So he didn't have that information at his fingertips, right there. And by the time he tried to get to me and they were already, so it's just, it's really sad of what's happening out there. So that's another reason why I had to leave the
right.
hospital, just because of what they're doing.
Yeah,
And, it didn't align with where I am, at this point, and me trying to educate and help people. So I felt that it was a conflict of interest. So I had to,
definitely.
yeah.
Well,
So
I mean, when you are delivering in a hospital, and I know like people who hear my podcast a lot. I mean, you probably think that I just am a total like Western medicine basher, and I'm not. I just think there's definitely a time and a place. And when you deliver in a hospital, number one, that is tons of germ exposure, tons of germ exposure, and everything is done. Seriously, everything is done for the quickness and for the convenience of the staff. And again, it's a medical condition. Like something's wrong with you, we need to fix it. And it's completely backwards. The woman should completely be running the show 100%. I've even had clients tell me that they weren't dilating quick enough. And I don't know all the circumstances, but that the OB actually cut their cervix.
what?
Yes, 2 clients told me that. And I was like, what? I literally didn't believe them because I thought, that's like, that's assault. Like, in my opinion, that's assault. And, well, that's a whole nother topic. Assaults, in labor and hospitals and all that other stuff. But I was completely baffled, and I said, it wasn't an episiotomy, like it was actually your cervix. And they said, yes, that it was the cervix that they cut. And I'm like, that's not going to be good, like forever, but for future pregnancies.
Exactly.
Wild. I was blown
Like
away.
the convenience, for them, and it's really
Right.
sad. And I keep bringing back to the evidence-based birth. But
Yeah.
again, they teach you that how to know the difference. And like you said, that is assault. And some people don't realize that or even know that. But for you to have the informed choices and knowing to make a decision, and it could have been something whereas if they would have been asking this provider questions ahead of time during their pregnancy, during their prenatal visits, they may have picked up on something saying, maybe this is not the right provider for me. You know what I mean?
Right.
And been able to switch earlier on as opposed to
Yeah. Well, and the part of the problem with that is, who is your insurance going to cover?
it's them. And
You
and then
know?
what's sad is that they say things, because I've heard couples have come back to me and said, well, they said if I don't do this, then my insurance is not going to pay for it.
Yeah.
I'm like, are you kidding me? They said something, I forgot what it's called, but they put down on the insurance papers, so whatever code or whatever that they use, saying that they refused treatment or whatever, so the insurance is not, or they refused the medical something, and the insurance is not going to cover it. I was like, are you kidding me?
Yeah.
So it's really sad of what's happening. But again, this information I'm trying to get out to educate women.
Right.
So with the classes, I've been, teaching more of the classes virtually. And now I love it because now we can teach, within the U.S., as opposed to prior to the pandemic, we were locally only to Georgia, about 50
Okay.
miles in our radius. But now we can
Sure.
teach it over the U.S. So I do like that. So anybody can take it, even where you are.
Yeah. No, that's amazing.
Classes also. So then, yes, I was able to expand, and just do more things, because really I had more time on my hand, after I left. So I'm still doing massage. I work with the Pregnancy Massage Center. And I'm doing the childbirth classes with evidence-based birth virtually. And now I'm really excited. I started postpartum check-ins. So
Yeah. Tell me about these boxes that you're doing. This
yes.
is
So
wonderful.
also those are trimester treat boxes. So that's even different from the postpartum check-ins.
Okay. Cool. Okay.
Yeah,
Cool.
so
Well, then you
the
just
postpartum
go ahead and tell me.
so the postpartum check-ins are, it's basically we go out to the home and check in on mom, and it's really for moms that again had had hospital births,
Right.
because when you're discharged from the hospital, what is it, 24 to 48 hours, that you're discharged from the hospital after birth, you don't go back to your provider for 6 weeks. California really tried to push for 3 weeks. I'm not sure if that went through or not, for their postpartum visit. Hopefully it has, but again, like you said, it takes time to do these things. So, so between that time, 48 hours and 6 weeks is a long time after you've just had a baby. Like
Yeah.
anything can happen, mentally, physically, anything can happen. So what our program, what we're doing is going into the home between that time from discharge, excuse me, to 6 weeks. And we're just really checking in, and that's all. And it's, so we're certified nurse assistants. And we're just checking them, like their vitals, seeing how they are, the temperature, their blood pressure, visually looking at them, seeing how they look, what's going on, and then just asking them questions, excuse me, questions that they may not have thought of, questions that a lot of times we notice with postpartum moms, things happen, but they think, oh, I just had a baby. This is probably normal.
Yeah.
Or they call their girlfriend down the street and they're like, yeah, girl, yeah, that happened to me too. But it could be something different. It could be a little more. It could be, their medical background. Anything can happen,
Right.
so basically a service that we're just kind of going in to check in, just to see how they are. It hasn't, I really wanted it to be really big and to go out a little more, but because of the pandemic, it's really hard to have people to go out, where everyone is safe. So
Sure. Absolutely.
yeah, as much as, so it's kind of small right now. Hopefully, once this whole thing is over, we can really get it out there.
Yeah.
But that is the program that I started then. So
So how often do you go out to see them in that 6 week time period?
so
Or
it's
ideally, what's the
Yeah,
program?
so it's usually the one visit, and it's like 2 to 3 hour visit where we're again checking on them, asking them questions. It's about 10 different things that we're going through, seeing how they are, if they want to talk, and then also giving them fruits and vegetables, a bag of fruits and vegetables, because nourishment is also important, especially if
Right.
they're nursing. Just after having a baby, it's important to stay nourished.
Right.
Um, so we also do that. So. Um, we also have like Nourish in Atlanta, which is a program that we're starting where 10% of all of our proceeds from our classes, our gift boxes, everything is going towards this Nourish in Atlanta program. So it's a donation base. So this way we can just go out. We're not checking in on them, but we're just delivering fruits and vegetables to the underserved, underprivileged communities. it's really the Black and indigenous communities
Right.
that have like the highest postpartum, maternal mortality rates and
Yes.
different things like that. So, trying to help that.
Yeah.
So,
And the other thing I wanted to touch on too is that what's different about how it used to be and how it's supposed to be is that after birth, we don't have our community of women who are coming in and checking on us. And I mean, after I had my son, my oldest, I totally didn't remember to eat for like almost 3 whole days. And my mom came over and, and I had had a C-section and he was jaundiced and we were working like trying to get me a breast pump and trying to get him the Billy Light and oh God, and I had to go and apply for nursing school. So just like all of this stuff was happening. And my mom came over and she said, Amy Lee, are you even eating? And I looked at her and I'm like, I don't even know. You know what I mean? I was dehydrated. I was starving. I totally had the baby blues. And it was just me and, his dad, and he didn't have any, experience at all with, other than babysitting.
Mhm.
So yeah, she basically made me
And
like a
your mom was
Thanksgiving
your
dinner.
check-in, and that's exactly what we're
Yeah.
doing. Your mom
Yeah.
was your postpartum check-in. Like you said, 3 days later, you haven't eaten, and it's like you didn't even think about it. It was not a thought in your mind
No.
because you were so focused on this baby.
Yeah.
And and like you said, now, whereas before communities used to gather, there's so many other countries where, mom doesn't do anything. I had a couple one time where I was doing childbirth education, and they said, yeah, my mom is coming over. She said, because I think they were from Brazil. She said they are not allowed to do anything. She said they can't even cook because something about it's with their culture. It's believed that getting close to a stove would dry up their milk or whatever,
Oh,
but they're not allowed to cook. Yes,
yeah.
it's like I was like, wow,
Whatever works, man.
exactly. But the mom was coming over to help. But like you said, here we don't have that. And
Yeah.
now that we're in a pandemic, it's even worse because even if
Right.
someone was going to try to come over, now it's like, where have you been? I don't know if I want you around me or my baby, sort of thing. So
Right.
really, it's really sad of what's happening now,
Yeah.
and especially to our women. For one, not having that support during labor, not having that support,
Mhm.
because if they can only have that one person, and it's the partner that doesn't know much or how to help, and then now coming home and not having that. And if you have that partner that works, so now you're home all day with the baby by yourself. And then, so it's a lot. It really is a lot. So I would like to bring more attention to postpartum, just because,
Absolutely.
now it's great that, information and education is out there for um, um, pregnancy, labor, birth. And then it's like we've dropped a ball,
Right.
postpartum, it's like really no information out there. So I really, really want to bring more attention to that.
Yeah. And I had 3 C-sections,
Oh gosh.
which is a massive abdominal surgery. And there is no rehab. It's basically signs and symptoms of infection. And people just treat you like you just had a baby. Oh, you just had a baby. I had a massive abdominal surgery. So many complications could happen. Thankfully they didn't with me, but it's so much more. I mean, then you're caring for, this baby. You're having to deal with all of those hormone shifts, especially for a new mom and you've never experienced it before. But really anyone, I mean, every pregnancy and recovery is completely different, just like your children are completely different. And yeah, yeah, it just blows my mind,
And then, of course, for African Americans, it's 3 to 4 times more likely to
Yes.
have complications or problems or something with it. So, yes, definitely. Like you said, it's major surgery, whereas a lot of times they're like, oh, it's just a C-section, it's birth, and they try to downplay it. But no, you're right, it is major surgery, and it should only be done in cases of emergency. I thank God that they are out there because they are life-saving procedures. But
Right.
in this country, it is so overused.
Right.
It really is, and it's sad.
Well, and I think had I had more support, had I had, proper encouragement and education. And if I was allowed to move and squat, maybe I would have never had to have that surgery. So my birth photos could have been beautiful instead of everybody in a blue sterile or green sterile, and then you don't get to hold your baby. You don't get to bond, so that's, it's just, we need to take it back.
Yeah. Too, whereas, there are providers out there that do family-centered cesareans, where you can hold your baby right in that, the surgical suite, right in the so there are some providers that do that, but again, you have to make sure you have a provider that does that, if that is the case, if it's going to happen. Some people, of course, like I said, it is a life-saving procedure where they have some sort of medical issue or something going on, and they know ahead of time that we have to schedule a C-section for everyone to be safe. And I understand that. I totally get that.
Yeah, for sure.
There are some providers, like I said, that are offering that. So you want to find that provider that, there are a few in the Atlanta area, but you have to find them. You have to know, and you want to speak to them ahead of time and let them know, where that's.
And there are also providers out there that schedule C-sections around their vacations. So, and that's a real thing.
Yes, exactly. Yeah, and it's overused here. But you have to think about it too, because, in the US, we have so many more obstetricians than we do midwives. In other countries, they have so many more midwives than they do obstetricians. Okay?
Right.
And what happens with obstetricians? They go to school for years, and then they have the residency for years, but they're training for surgery. So they are surgeons. This is what they do. They're not training for natural births.
No.
They're not training for water births. It's how many do they actually sit through all their years of training? And it's probably, you can count on one hand.
Oh yeah, they're not with you through the birth. They're there to catch.
Exactly.
Yeah,
so.
I know where I am in Wausau, Wisconsin, we have a very large Hmong population. And, the Hmong people, they're the Hill people that helped us during, the Vietnam War and everything. So that's why they're here. But they would always deliver at home and do everything natural. And they would save the placenta and they would do whatever they do with it, and they have all of their, cultural things and their, religious things or spiritual beliefs or whatever. And I remember working in the hospital, and many of them, when they were first coming over, I was hearing the stories. Now a lot of them have kind of been Americanized, but they refused to deliver if there was a male in the room. No. They would literally hold it. They would literally not push. And then, at home squatting. So they would lay a sheet on the floor, and then, our teacher said she couldn't, as soon as that doctor was out, they pushed that baby out on the floor by themselves, because they didn't want a male doctor there.
Wow. Yeah. And how many male obstetricians are there now?
Yeah. Well, and it would be interesting, just to actually have your OB sit with you through the whole entire labor, see what you're actually going through, because, even, and the female OBs, they're trained by men in a male system, in a male society. So they, a lot of times they don't get it until they have a child of their own.
Yes.
And then sometimes they shift and sometimes they don't.
And that's what I was going to say. Some do, because I have, there's a lot of, a few, I'm not going to say a lot. There are a few of these that I know that, are obstetricians, and they've actually, done a home birth, or they've done at the birth center, or they've, sought out wherever they work, they're like, no, I don't want to give birth there. And that's really sad to hear, but but like I said, they know, so it's good that they are there, because they are making a difference, where they are. So I'm glad that they are there. So there are a few out there that, know what's happening and see what's happening, and they are, trying to make a difference. So not all OBs are bad. I'm not saying
definitely not.
Because there are some really, really good ones.
Yeah.
And I even look at them like, are you really an OB? I think you're a midwife in disguise, because like the one that, that helped with my grandson, 4 years. Oh my gosh, I love her. Um, but she, again, I was like, you know what? I don't think you're an OB. I think you're a midwife in disguise.
Yeah.
Yes. So, so
Wonderful.
my trimester treats is where I
Yes.
wanted that. So that is the last thing. We just launched that last week, a couple of days ago. Everything is, all these days are all running together.
Yeah, I think it was last week. I feel like I saw your live or something last week.
Okay, thank you. So last week we launched our trimester treats. So that's our pregnancy subscription boxes. We are so excited about that. So instead of, because there's other subscription boxes out there, but we're not doing a monthly subscription. We're doing trimesters. So it's information, well, it's products that, are used within this trimester. Like the first one has a lot of things that have to deal with, the nausea, or it has books. It has Rebecca Decker's, and that's the one that created Evidence-Based Birth, that has her book. So you can get that in the beginning. You can read that information in the beginning and know what you need to do and how you need. So it'll help you in the beginning to make these decisions and not wait until the end. So it has that information. So that's what the first trimester. Second trimester helps you with, now your body is changing. Now your body is growing. Now, things are happening now. And it's like, okay, now things may be aching, like pulling and stretching. And, now you have these breasts that you didn't have before. Or now, with your uterus growing. So now your back, your lower back, and especially now, if you're on a computer a lot, especially with our virtual and everything that we're doing, if we're on a computer a lot, so you're feeling aches and pains and different things that you haven't felt before, just growing pains,
Sure.
So a lot of the second trimester is focused on that. Third trimester is our labor box, and it is sort of focused on labor. So it helps you and it gives you things that you will need in labor. And then we have a fourth trimester, because fourth trimester is a thing, again, trying to really push this. So I have t-shirts out that says fourth trimester is a thing. I want to do like I can't think of the word right now. Oh my gosh.
Okay.
Anyway, you want to sell the t-shirts and then, have that donation go to the Nourish in Atlanta program.
Oh, nice.
But with the fourth trimester, it is, like we said, postpartum, what's happening with your body postpartum to kind of help you to deal and adjust with life with a baby, and, your body not being pregnant anymore, because that, is a big thing too, mentally and physically, your body just went through a lot. Okay. It was like 9 months, really 10 because of 40 weeks, but 9 months for your body to prepare.
Why do they say that? Why do they say that?
I don't know. Like mentally you're trying to, it sounds better.
Yeah.
But again, helping your body, it takes that time to prepare. But so many women are so hard on themselves, thinking that, right after I have this baby, I need to bounce back to my size where I was.
Oh, yeah, that's a big one.
Yes.
Nope.
Give your body a chance, especially if you're nursing, if you're, your body has changed a lot. It has so many hormones and everything is going on. Again, just physically and mentally, your body went from being pregnant, giving birth to this baby, and now not having a baby inside of them. It's like, okay, wait, what is happening? So you need time to adjust.
And it took you 10 months to gain that weight.
Exactly.
So give yourself, a year and a half. And by then you're pregnant again. At least that was my case.
And I've had, women come in sometimes and they're like, okay, it's 6 weeks now, and so I should be back to my size. Like, no,
6
give
weeks.
yourself some time. Yes.
So. I tell women that's the absolute last thing you should be thinking about right now. Because honestly, hormones control everything. And if you try to lose weight that soon, and you're not going to be able to breastfeed, for one thing, your milk's going to dry up. You have to do what your body naturally wants to do. And when you have a baby, you just give birth, your body wants to eat. And so, yeah, when I have people in my life who have babies that I'm close to, I get big, huge pads, whatever their favorite candy is, and then like some really, just some good comfort food, like soups or chowders or something that's full of, warmth and goodness. you know.
That's what we wanted to do for the Nourish in Atlanta program, because we've modeled that program, and that's, like I said, our donation base. So we're trying to get that out there too. But we've modeled that program from, a bigger program, which is in California, and it's called Nourish. And they have it's a 6-week program where they get moms, and for 6 weeks they are feeding the moms, and they have, they've partnered with restaurants, and so it's cooked meals that they have.
Oh, wonderful.
But they have like a large, help with volunteers, and, and they've been putting this together for a long time. So I didn't want to wait till I got to that point. I wanted to start somewhere.
Right.
So I figured I'd start small here with the fruits and vegetables, because that's important, and then I ultimately want to grow to that too, because right now it's just a bag that we're giving to, a mom.
Right.
But if we can give 6 weeks worth of food postpartum, are you kidding me? Do you know how life-changing that can be for some people?
Yeah, that's huge.
Oh my goodness.
Sometimes there are moms groups or church groups that will have like a food chain,
Yes.
kind of like their phone chain,
Mhm.
and or prayer chain rather. And those are really, really wonderful. I was part of one of those organizations, and yeah, it was 6 weeks that everybody just signed up to take a meal a couple days a week or something. And I mean, it's so important because you just don't remember,
Yes.
or you shouldn't have to. Like, you should just be resting and cuddling that baby and
Exactly.
sleeping as much as you can, because you need to recover.
Yeah, during my childbirth classes, I do suggest a meal train also, whereas, they have people sign up. If you are going to have people come over to visit or something, do something worthwhile, whereas having them bring a meal. A lot of people want to help, and a lot of people, for one, they don't want to bring another onesie. For one, you don't need another onesie. And is your
Yeah,
baby going to wear it? They're not going anywhere now,
right.
why do they need it? So when you have like a million clothes and different things that they, so many, and I've done it myself, had so many tags on clothes that, after the baby has grown out of it, they don't even get to wear all these things. So why, spend the money or something like that? Whereas they can do something that really can benefit everyone, because if mom can eat, then baby can eat, and baby can be healthy. So mom doesn't have to cook, then it's giving them more time to rest and, be able to be there to bond more with that child.
Mm-hmm.
So when someone comes over, instead of bringing a onesie, bring a meal, come over, do a load of the laundry. And,
Yes.
and I tell them, and sometimes, with the partners, and they're like, well, I don't want them touching my underwear. I understand that. They don't have to wash your underwear, but do the baby's laundry. The baby
Yeah.
gets a lot of laundry, even if they're not going
Or
anywhere.
wash the dishes or vacuum or who knows, scrub a
Exactly.
toilet,
Yeah, exactly. The bathroom is important. You want to keep that clean too,
Yeah,
so, and you may not want to be down scrubbing your toilet or your shower,
right.
or, something like that. So it is important.
And you could also, if you, of course, given the current state, if somebody is comfortable, if they have multiple children, you know, take the older ones, if that's possible, just, take, the older ones for a while, because I have 3, and each C-section was harder to, recover from because I had more to do at home. I didn't mow the lawn, I didn't do steps, I did all the things I was supposed to do, but I still had 2 other children that I had to drive around, and I had to, care for them. So, sometimes a break, for even just an afternoon so I could sleep would have been great.
And even if their children are close in age, like you said, a year and a half, 2 years apart, that older child doesn't understand why now you can't be and play and get down on the floor with them like you used to, or
Right.
why you're spending so much time with this new baby and not time with me. So yes,
Yeah.
that's important too, for that, if someone can take that, or even just come over and spend time with the child, even if
Right.
you don't
To
have to
make
leave.
them feel
Yeah,
special.
exactly. When you're bringing something, bring something for the older child too,
Yeah.
just yeah, exactly. Like you said, just to help them to feel special. And then,
Yeah.
because if that older child has peace, then everyone has peace.
Yeah. Yeah. Sometimes it's like that for sure.
Mhm.
Oh, this is so great.
Yes.
Well, this has been a lot of information packed into a lot. And I just want to have an open invitation for you to come back on the podcast when you get more programs going or if something new happens, because I think this is really, really important. But if you could just really quick kind of give a shout out and let people know how they can find you and how they can get involved.
Okay, well, thank you so much. So my website is www.tarasbirthservices.com. And on Instagram, I am taradthompson.co. I have on Facebook, I'm Tara Thompson, and I also have Tara's Birth Services. So that's how you can find me on social media. Again, going through my website, we are trying to keep up with everything that's going on. So
Sure.
we don't know how to create a donation button yet, whereas it will all go to, the program instead of, like some taking out a portion of this or going here. We're trying to make
Sure.
sure it all goes there. So that's what we're trying to do now. So reach out to us if you would like to make a donation. But again, with the donations, we have a donation-based program where we are focused on Nourish in Atlanta. We are giving fruits and vegetables, a bag of fruits and vegetables to a postpartum mom. And we are actually participating in a walk on November 7th. So I don't have the link to that. I apologize, but I do plan to post it on my website.
Yeah.
But with that walk, it's because, October is Pregnancy and Infant Loss Awareness Month. So
Right.
I had a mom that I was working with virtually. It's actually a friend of a family, but I worked with her virtually with her first child. Her second child, she lost. So she wants to do a walk. So she is taking a portion of those proceeds and donating it to the Nourish in Atlanta program. So
Wonderful.
We're really excited about that. Yes. So it's $22 to participate in that. And you can do it virtually. And you'll get a t-shirt and I forgot what else, but to kind of help with that. So it's called Walking with Wings. And again, that's for pregnancy and infant awareness. So
Yeah.
have that.
Well, and this is just super interesting to me, but can you tell people who are listening how, because I'm actually kind of interested, in learning more about how do you start this Nourish program? Because obviously you're modeling after California. I mean, it could be like Nourish Wisconsin, Nourish Illinois, Nourish all over. So how can we find information on getting that started?
So if you go to the Nourish program, which again was based out of California, so the company is Mother to Mother Postpartum.
Okay.
Like I said, that's in postpartum, and their program is just called Nourish. And they sent out, and you can email them and, just reach out to them and they will help you because like I said, we wasn't able to call ourselves Nourish because of course
they've already got it.
Exactly, for everything there. But they said, you can definitely do Nourish in Atlanta. So they gave us the idea and I was like, I love that. So yes, that is my goal for other places because that is something, yes, I will send you the information.
Yes, please do. Because all of the stuff will be put into the show notes. Okay. So people can read all of it.
Okay, awesome.
Yeah,
awesome.
Wonderful.
I will send you that information. Yes.
Oh, this has been so good. I feel like I could just talk to you for hours.
Nourish programs are all over. This would be so amazing. Yes.
It would be. It would definitely change things. I follow some midwives on Facebook and birthing centers and stuff on Instagram, and they always basically say, women have to take back birth. And I was like, why was birth ever removed from women anyway?
They got involved.
I'm the one doing it. Yeah, so they can be helpful. They can be a good support system, but sometimes they need to stand aside.
Yeah, exactly.
Wonderful. Thank you so much, Tara, for your time. I really appreciate it.
I really did enjoy this, so thank you so much.
Thank you for joining me today on Women's Pelvis Wellness, where you can be heard. Because remember, if you're not being heard, you're not being helped. Please join my Facebook group by the same name, Women's Pelvis Wellness, and join a community of women who are there for you to support you, guide you, and love you through your pelvic health struggles. Also, this is a great place to check out my new class schedule. Thank you for joining me and becoming a pelvis wellness warrior.